If you're wise, exercise all the fat off. Take it off of here, off of there. When you're seen anywhere with your hat off, have a Marcel wave in your hair.
Welcome back to the Steph Show. It's just gone 11 o'clock on a beautiful Saturday morning. It's the end of June. It's the last day of June, I think, isn't it? The 30th of June, 1st of July. Tomorrow I'll be another year old in a week's time. And if you've just joined us, pull up a sofa, slim it out into the garden, have a cup of coffee, relax, and enjoy yourself. And if you're having breakfast and you've got a bit of a hangover, well done. Well done, beef.
Well done, beef.
And so if you want to call us, we'd love to hear from you. It's 0344 499 1000. You can tweet us at Talk Radio, of course, which is free, or you can text Talk and your message to 87222. So, Danny, go on. Off
Very
you go.
excited.
Very excited,
I really am. We've had the most amazing guest in this morning. She's come all the way into the studio to talk to us. Now, I heard about this lady and what she's all about a couple of weekends ago at a barbecue where a group of ladies were sitting chatting and were filling me in on this new procedure. And so immediately I got hold of Elif and said, we've got to have this lady on the show because everyone should know about this, and we should sort of break any taboos, if there are any out there, what have you, that, you know, women of a certain age might need your help. So before I say any more, I'd like to welcome Dr. Shirin, is it
Lakhani.
Lakhani, good morning.
To the studio.
Good morning.
Good morning. Welcome.
Morning, Shirin. Thank you for coming out on
Thank you for having me.
Super Saturday morning. It's a pleasure.
Now, Elite Aesthetics is your company, yes?
Yes, that's my company in Kent.
In Kent. So tell me all about, I'm going to let you tell everybody all about it and how it all started and your background and what have you. So first of all, how did you come into having Elite Aesthetics?
Okay, so I'm a doctor. I've been a doctor for nearly 20 years, surprisingly.
Really?
Good Lord, you don't have to day over 25.
Oh my gosh, I love you.
Obviously something's working.
Something's good. Yeah.
Thank you. I kind of stumbled into aesthetics. I was doing general practice at the time, and I found quickly that it completely took over my life. I loved the confidence I can give to people.
Interesting.
And just how happy they are when they come and see me and when they leave. And it was a complete contrast to what I was seeing in the NHS.
Okay, so aesthetics, we're sort of talking
beauty treatment,
treatments, a little bit of surgery,
everything I do is non-surgical. I'm not a surgeon,
right.
So I stick within my limitations. But it is things, it's little tweaks you can do to your appearance to make you look and feel better. And then it's kind of gone beyond that as well, because a lot of the treatments I do are more about well-being, and also I do a lot of intimate health, which is my specialty.
Okay, so that's the thing that we're here talking about, really. I think probably, as you would say, medicine's probably evolved, hasn't it? And procedures have evolved hugely. As you say, there are fewer surgical procedures now, many more non-surgical procedures. And we're talking about the lady department, aren't we?
Yes, so that is one of the things I specialise in. Things have really evolved. There's been lots and lots of new developments, and you can actually do a lot more without surgery now. The other thing is you can do a lot more for conditions that you couldn't really help in the past,
such as
stress urinary incontinence, sexual dysfunction. You can help ladies with menopausal symptoms as well, and you can do all of this without medication and without surgery, with very little downtime.
Wow. So what would you say? Sorry.
Yeah, well, I'm just going to, how, menopausal issues quite difficult because it's all to do with estrogen and blood and all sorts of weird and wonderful stuff. If it's not medical, how can you help with that?
Well, in terms of menopausal issues, you get the issues that affect your whole body, such as the hot flushes and things like that. But you also get localized issues, such as vaginal dryness, irritation, more urinary infections, painful intercourse. So one of the treatments I do is called the O-shot. I don't know if you've heard of the vampire facial and the vampire facelift.
Yes. Now, is that where they inject blood, your own blood, or?
Yes, that's right. So what I do is I take my patient's blood and I spin it in my centrifuge, and we extract a concentrated platelet-rich plasma, essentially. So that's what is used to rejuvenate. The chap who invented the vampire facial then went on to experiment with other areas of the body, and that's how the O-shot came to be.
That's
right,
amazing.
so this is like the initial thing is the O-shot. This is not something you drink.
No.
It's not sort of like alcoholic orange juice, is it?
No.
In a very small glass. So what exactly is the O-shot?
So the O-shot is the injection of this platelet-rich plasma, which is your concentrated platelets, into the vagina and the clitoris.
Right.
What it does is we trick the body into thinking there's been an injury.
Oh.
And platelets are actually what heal you when, for example, when you have a cut.
Yes.
And they cause regeneration of the nerves, improvement of the blood supply, and they just cause an overall improvement and rejuvenation of the area.
Wow. So how did you come across that? Was it by chance, or did you just one day think, oh, I'll try it down there?
Let's inject it. Yeah.
Yes, because it's quite a leap, isn't it, from your forehead to your nose?
Well, I mean, I was fortunate enough to meet Charles Runnels, who was already carrying out the procedure in the States.
Right.
And I've trained with him, and when I found out about it, I was absolutely amazed that you could treat incontinence without surgery.
That's because it's so. I mean, the original nip and tuck is about female incontinence. That's the original procedure where they have to.
Is it?
Yeah, where the bladder attaches.
Yeah,
and
they have a
reattach.
mesh. I don't know if you've heard about the issues with the mesh in the press, but that's another story. But generally, for stress incontinence, the first thing that people were told to do was pelvic floor exercises.
Right.
Now, if you're anything like a normal woman, the only time you do your pelvic floors is when someone says it.
That's absolutely right.
And
You're absolutely
I bet
right.
we're doing it.
Yeah, I've just done it. Actually.
I am.
I know they have the issue.
So, although they can be effective, people don't do them enough for them to be effective.
Yeah.
So the other option was the mesh repair, which is the transvaginal tape or TVT.
Right.
Alongside that is the issues of having surgery, the complications that go with it.
And the cost, obviously.
And the cost as well. So now, I mean, when I first came into this part of the industry, I was absolutely amazed that you could treat incontinence with a small injection, and it is pain-free.
Wow.
It is quick. There's no downtime.
Wow.
And as things have evolved, there's been other treatments now that you can use in that area to rejuvenate. So alongside the O-shot, I also use a treatment called the Femme 360, which is radio frequency for the vagina.
Yeah.
Radio frequency.
Yeah.
Right.
Okay. So what that involves is heating the vaginal tissues to an adequate temperature to cause collagen stimulation.
Yes.
And new blood vessel growth. It also causes tightening of the vaginal canal.
Wow.
And improves the support to the bladder as well. So actually what I'm doing now is a combination of both the treatments for incontinence and for sexual dysfunction.
That's very good because you get, double bubble, literally. Two for the price of one, You have a good time and don't wee while you're doing it.
Absolutely. But, I mean, it's incredible.
In theory.
I have to say the number of women that are now able to come forward, whereas before it's a taboo subject.
That's why I wanted you on the show, because I thought, no, it shouldn't be, because it happens in every bedroom, in every house. In theory, it should be. And why, for women, it's somehow shameful to discuss issues in the lady department, I don't know, because we're the ones that go through all the childbirth and all the, all our, really, everyone gets a good old, how's your father looking when having children, no privacy there, but then suddenly we're not, you shouldn't talk about it. So I really applaud you for doing that, because these things are really important. Ladies don't really want to be walking around with a pad, worried to laugh too loudly in case they wee while they're out. It's not funny, really.
The thing is, it doesn't just affect older women as well. It affects women in their 20s who've never had children.
Really?
I think it's about 5% of 20-year-olds have a problem with incontinence, to the point where...
that's a huge amount.
Really?
Yeah.
Of
It's 1 in 20-year-olds.
Didn't know that.
And by the time you get to your 30s, you're looking at 1 in 3 women
What?
have an issue with stress incontinence.
And when you say stress incontinence,
that's the one where
being
you
stressed,
leak.
and
No,
then you...
no, it's when you leak when you jump or cough or laugh. And you think those are the ladies that have got young children and want to be out jumping on trampolines with them and keeping themselves fit and healthy. And they're suffering, but nobody talks about it.
God, I think this is amazing. How long have you been doing this for now?
Well, as I said, I've been a doctor for 20 years, and even when I was doing general practice, I had an interest in women's health.
Yeah.
The thing I found, though, moving into the private sector and being in the aesthetics industry...
In more ways than
In
one.
more ways than one. In a very private sector.
But there's more finance to look at different treatments. So because it's all privately funded, you're not restricted to budgets as such, like the NHS is. There's more innovation happening in this industry than is actually happening in the NHS.
Right. Now, on a day when it's been announced that the NHS are going to cut back on unnecessary procedures such as breast reduction and other bits and pieces, I'm intrigued to find out who's going to make those decisions and who, and the bad ones. I heard earlier this morning they were talking about not doing carpal tunnel syndrome. So is this currently available on the NHS? And if it is, it's probably going to be axed and it will just go to the private health.
None of the treatments I do for intimate health, unfortunately, are available on the NHS.
Right.
It's one of the ones, you think women make up more than 50% of the population now, and the majority do go through issues after childbirth and even with ageing. Men's health got more of a focus in the early 90s and sort of mid to late 90s with the invention of Viagra.
Yes.
But there wasn't anything for women.
Yes. And they've been looking for something, haven't they?
Isn't there a feminine Viagra, a women's Viagra now?
It's an antidepressant. It's a centrally acting antidepressant. So it
would subdue you rather than...
It's centrally acting. So it acts on the brain.
Right.
It
stops
doesn't act...
you being from depressed, and then we're here, you sort of think, well, I'm in the mood.
Well, in the 80s, the attitude was that erectile dysfunction is all in the mind. So now the same sort of thing is being said about female sexual dysfunction, and we're about 30 years behind men in terms of innovation for that, and it shouldn't be that way.
Yeah.
So I've got a couple of tweets and messages, etc. Ford wants to know how much this cost.
Yeah, I was just about to say, how much does this cost?
Hello, Ford.
Hello, Ford.
Or are you from Ford?
I don't know, it just says Ford.
Okay.
Hi. Okay, so the O-shot costs £1,200 for a treatment.
Is it one-off treatment?
Generally, it's once a year for maintenance. Nothing's permanent. So if you get your result with one treatment, then you tend to have to repeat it every 12 to 18 months. The Femme, which is the vaginal tightening, that is also £1,200 for a course of 3 treatments.
Yeah.
And that needs to be maintained every 6 months, and that's just one treatment every 6 months.
Wow.
Wow, £1,200 a lip.
There's a labial puff. What is a labial puff?
Right, the labial puff involves injecting dermal fillers into the...
So what you would put in your top lip, you put in your bottom lips?
Sort of,
yeah.
Essentially,
okay.
That's what it is.
To get that
puffy
pouting
feeling.
Fish look.
Yes.
With the...
trouble is then you'll get camel toe, won't you?
Big time.
It looks overdone, but a lot of ladies lose volume.
Carpal tunnel syndrome. Carp tunnel.
You're having fun with this, aren't you, Don? I knew you would.
And Ford is from Camden Town, and and Andrew says, okay, can we talk about penile extension? So we've got some balance.
Well, I was about to say, you do a P-shot,
I do a P-shot as well, which is the man's equivalent of the O-shot, and one of the side effects of that treatment is an increase in size.
Woohoo! There we go.
And that's just...
I say that is a side effect. It is the same sort of treatment. It's injection of platelet-rich plasma.
And does that mean you're standing up to attention ad infinitum, or...?
No, it just means that when you do have an erection, it is stronger.
Wow.
Okay,
and that's 1,200 quid, I would imagine.
Yes.
That's another 1,200 quid on the knob. Jolly good. There you are, Andrew. We've answered your question. I think we better just go for a break.
Yes,
We'll be right back in a minute.
Talk radio.
We got entered. Something women really want to tell men about.
It's true.
So I'm on a massive learning curve here this morning.
So talk us through we were just about to talk about the P-shot, and then I want to hear about your time on this morning, because I understand that was quite scary, Mary.
Yeah. So with the P-shot, as I said, it's the male equivalent.
Yeah.
And many of the patients I've had who've had to use Viagra to help them get an erection actually reduce their dose dramatically or stop taking it altogether.
Really? Because it's just it's rejuvenating the
blood supply and also
isn't it?
the sensitivity and the nervous system in the penis. It just rejuvenates all the nerve endings.
And it's literally 8 minutes long or something.
No.
Inches.
Shush. You see, she's gone. There we go. She's gone. That did it.
Brilliant, fantastic.
There we go. She's corpsed. Oh, I'm so pleased with myself now. I wondered what I was going to be able to say to her to make her go, because she'll have heard every single pun and connotation, but 8 minutes long.
No, the vaginal tightening's an 8-minute treatment. The P-shot
is 12.
12 inches.
But imagine it's when you did say just before the break, it's actually the separating of the blood to get the platelets out. So it takes more time than the rest of it.
Absolutely. With the O-shot and the P-shot, it can take anywhere between 20 and 40 minutes, depending on how much blood I take to spin. And then the actual injection time is a couple of minutes.
Unbelievable. And it's not painful. You just put little...
And is it lots of little injections, lots of little pricks?
I've heard that one before.
Yeah.
Or is it just one?
You only feel one because I give the men a nerve block. So you only feel the one prick, but there are a
for
few
some
more.
Time. 58 years, yeah, it's gone.
And then, I mean, with the vaginal tightening, that's what I was on this morning with. And
tell me about that.
Nerve-wracking experience.
Whoa.
I actually performed the procedure live on TV.
In the morning?
In the morning.
Before breakfast?
After breakfast.
About 10 o'clock. On the television?
On the television.
Presumably behind the screen.
Absolutely.
Okay, so what happened?
We maintained my patient's dignity, but it was a very brave patient who came on air to try and highlight the issues of women's intimate health and how we don't talk about things enough, and actually we should.
And was Piers Morgan interviewing you?
No, I had Holly, fortunately.
I was going to say, because he'd have gone to town on this, wouldn't he?
I'm sure he would.
Ripped you to shreds. But was it worth doing? How was the response afterwards?
The response was absolutely incredible. I mean, obviously we had all the national press screaming about what I did on TV.
Why would they scream? Was it in a negative way?
They put it out in a slightly negative way because they always use the term designer vagina, which I absolutely loathe.
It's not a design.
It's not about
that
at all.
Changing it.
Oh, because you don't have
like
logos.
it.
No, it's about more functional issues. But what I found absolutely overwhelming was the emails and phone calls that I got from real patients who actually said thank you.
Yes.
I felt lost. I didn't know there was anything I can do, and thank you for highlighting the issue.
I think you might very well be responsible for saving thousands of relationships.
The feedback I get from my patients is just incredible, and the stories I hear from them about how it does completely change their lives.
Well, I think I should go and have it done.
I think you should.
Sorry, what did you say?
You heard?
You think you should go and have it
Why
done?
not?
Shall I have the P-shot then?
Why not?
Do you know what?
Really?
People do come as couples.
Why not?
Really?
Why not?
Really?
Happy birthday, darling.
Well, it's not really for me, is it? Oh, okay. Well, you know. Phew.
Well, there you go.
That's sorry to
watch
get the wind
this
out of my sails. Really.
We
Inflated my balloon there, I think, or something. Popped my bubble.
Oh dear. Well, I don't see why not. You know.
So the radiotherapy, you obviously
radio frequency.
Radio frequency. Does that mean you sort of
you pick up Luxembourg?
Get a digital radio and shove it up there for half an hour or something?
It's basically a current and it generates heat, so you get heating up in the tissues. It's not a new technology. We've used it for body contouring for years.
Right.
And it's just now an extension of...
Is that breaking down fat?
Skin tightening, collagen stimulation. Depending on the depth you go to, you can break down fat as well.
Right.
So what would you say is your most effective treatment that you give out of everything that you give? What's the one that you see the most and best results with?
That's a really difficult question because what area are we talking about? Because I treat the whole person from head to toe.
Yeah,
so it depends on what they come in with, really.
Yes, and I suppose anything because mostly this, although it's a physical issue, the issue is exacerbated because it is such a mental issue, and people who are experiencing difficulties, I would imagine, are emotionally very damaged by that.
Absolutely. And part of what I do is look at the whole person.
Yes.
And I mean, people sometimes have a very negative view of the aesthetics industry.
Yeah.
But it isn't about that whole, let's create some big lips and make you look abnormal.
No.
It's about restoring somebody's confidence and letting them rebuild relationships as well.
Now, what do you think about shows like Love Island, where you have young ladies and the women today that are portrayed in magazines and all over the television that are, so immaculate but so fake in terms of, fake eyelashes everywhere, eyebrows, extensions, boob jobs, mouth jobs, head jobs, forehead, everything is tweaked and it's not natural. I wonder how you feel about, I feel that young women these days, it's not a good thing to aspire to, but I wonder if you see that as a negative, possibly.
I have 2 daughters as well, so I want them to be confident in who they are and not aspire to, as you say, the images of fakeness that you see at the moment. For me, in my clinic, we don't do those sorts of treatments. It's all about restoring what you had, not creating what you never had. It's about making you natural and basically giving you a refresh rather than a completely different face.
It's like a reboot.
I think that's much better because it's the one thing that, we always say together that he won't let me touch anything because it stops making you look like you.
Yeah. A lot of my patients don't tell their partners that they're coming to me, and they get compliments on how well they look rather than what they've had done.
Now, a DIY version possibly of some of this might be to misappropriate curling tongs, and you probably don't advise that. It's probably not something you should be doing at home.
No,
just to sort of warm up the. Don't go there.
Personally, I think if you're going to have a treatment like this done, go to a doctor who has experience in intimate health.
Definitely.
A lot of people are setting up shop. As you know, there's no regulation in the UK.
That's a real concern because then that's hampering your progress.
Absolutely, and you hear about complications. Well, we hear about complications all the time from people who aren't qualified in the treatments they're performing.
So what would, if, let's say, for instance, somebody can't come to you and they were to research because they're in Edinburgh or wherever, what should they be looking out for in terms of qualifications if they were to try and find somebody to help them?
So in terms of the treatments I perform, the O-shot and the Femme, there are clinic finder websites for people who are qualified to perform the procedures.
Good.
I personally think you should speak to the person you're thinking about getting the treatment from and actually ask to see their certificates, ask them what experience they have in the field as well.
Good.
Because sometimes it's not enough just being medical. If you have no knowledge of the female intimate anatomy or even the male intimate anatomy, you probably shouldn't be in that area.
Yes, it's not making a quick buck from somebody's curiosity or insecurity. And I suppose I'd probably ask them their numbers, their statistics on success, and what they value as success, and I suppose is there a TripAdvisor for something like leave a review for the O-shot? There must be somewhere.
The Real Self is becoming like that. It's an American website, but it is starting to take off in the UK, and I think that will probably be the sort of TripAdvisor of the cosmetic industry.
Because you can't go trustatrader.com, can you? What are you giggling at?
I'm giggling at. I've had a message from Tom somewhere, and I'm not sure.
It's a full ticket.
Ellen, have you read it? Can you read it? Do you reckon I can read that out? It's quite an old.
I'm looking at her. Maybe.
Yeah,
go on then.
Yeah, it's Jim from the Burns unit, which I'd like to thank Mrs. Smith who donated towards his new ears. After a little nip and tuck.
What? I suppose it happens.
We'll
I
have
suppose it
Ofcom
happens.
on the phone.
We will.
Waste not, want not.
But I think it's
called upcycling, isn't it?
Yes, upselling. Yes. I suspect, that with so much in the press of, gender reassignment procedures, the concern here would be that people would just label this sort of treatment in amongst with that, and actually they're two very separate things, aren't they?
Yeah, so the treatments I do, as I said to you before, are more for function rather than appearance. You can alter the appearance as well to some extent, but I mean, you have to remember these are consenting adults as well, and they've thought about it. It's not, some people associate aesthetic gynecology with female genital mutilation.
Yes, exactly.
And it's very, very different if you've got an adult who is fully aware of the procedure they're about to undertake compared with a child who's having it forced on them. They're actually very different issues. And as I said, it is very much about function and improving things as we age. And once upon a time, I think menopause was seen as the end of life, but it isn't anymore. We live a lot longer.
Yes, exactly.
So why should we as women have to just pack up and let everything go just because we hit menopause?
Yeah, just because our ovaries shrivel up doesn't mean that we have.
No, absolutely.
You know, and I think it should be the beginning of the next stage of your life, which should be exciting and have much more freedom, possibly, because there's no danger of falling pregnant. So, you know, it should have a mental switch, a mental attitude switch, I would have said.
To change everything around. Now, I'm presuming, given the fact that actually what you're doing is injecting us with our own blood, that there's very little that can go wrong.
The side effect profile is fantastic for these treatments because it is your own blood product. The risk of allergy is zero. You're not using things like fillers, so you don't get the complications with lumps and problems with injecting into tissues, like injecting foreign material into the tissues. The main risks are actually from the injection itself, from the needle. So minor risks like bruising, bleeding.
And who would you say? Are there any people out there who you wouldn't advise this? Various conditions would mean that you can't have this.
Yeah. So because the treatment, the PRP treatments involve your platelets, if you've got any abnormality with your platelets, you probably wouldn't do well with the treatments. We don't treat anyone with active cancer, and I don't treat people with active infections and things like that. So as long as your platelets are okay, you generally can have the treatment. There's certain medications that do affect your platelets, so things like ibuprofen, aspirin, steroids, and also smoking affects your platelets. So if you're a smoker, you don't get as good a response.
Okay, and warfarin, I would imagine, as well.
Not so much. Warfarin affects a different part of the clotting cascade. So with these treatments, it may make you more prone to bruising, but it doesn't actually affect your platelets.
So smokers are probably going to have to do it twice a year rather than once a year.
Yeah, it does tend to last less time in smokers, and they don't get as strong a result. But that's not to say they don't get a result.
Well, how can we find you? If you let me know your www.ness.
It's www.elite-aesthetics.co.uk.
Great.
And aesthetics is
.co.uk. And you are based currently in Kent?
Yes, round the corner from Bluewater, so you can combine a trip to me with shopping.
I love that. Get your new done and buy some new knickers at the same time. For your new.
Bigger
pants. Marvellous. Absolutely fantastic. Listen, you have been a joy.
It's been an eye-opener.
I've lost him, that's it. For the rest of the day now, that's it. I knew this would happen. I'm trying to take it all very seriously and be respectful.
I am taking it remarkably seriously. I think it's a fantastic thing.
I just want to say
rather giddy and excited.
Thank you for having me on, just to highlight these issues.
It's an absolute pleasure. And actually, if we do go down the road of having, we'll come get you back on and we'll talk about the after effects.
Brilliant.
Why not? I don't see the problem.
Absolutely.
I'm happy to share my new stories.
Oh, yeah, really?
No, not really, but I will do. Thank you so much. Good luck, and hopefully I shall see you very shortly.
Thank you.
Thank you very much. Dr. Shirin Lakhani there from Elite Aesthetics, talking to us about the O-shot and the P-shot. And I think we'll go for a break now.
Silly boy.
Across